Hi, I'm Dr. Seth Hosmer, and I'm here at Hosmer Chiropractic Health. And what I wanted to show today is an advanced technique for loosening up the middle of your back. What we're talking about here is trying to find a way to get the lower thoracic spine and into the upper lumbar spine to relax. For a lot of people that sit every day, they find that their spine ends up being flexed forward and very stiff in through this region. And when they follow some of the normal procedures that we describe for loosening up your spine in that area, it's just too sore, and they can't find that they ever get past that soreness. And so they end up with a section of their spine in the lower thoracics and upper lumbar where they just don't ever really get the motion back that they're looking for. So what we're going to do today is show you how to get some movement back into that area in a way that's a bit more comfortable than what we've shown for the rest of the thoracic spine. But we're going to start with a very quick review of what we do for the rest of the thoracic spine so that we can contrast the two. So what we're generally showing with the rest of the thoracic spine is that we alternate between lowering down, spending a few breaths down in this position, and then starting to come back up, bring the elbows together, and then flex this way. Then coming back down, move the roller down, all the way down towards the floor, then back up, elbows together, and then up in center. And so this works well for the upper spine, but people find that as they get down to, say, maybe the middle of their rib cage or a little bit lower, it becomes too tender as they're dropping back, and so they never feel like they get a good release in that area. So what we're going to do is a little bit different. We're going to bring a pillow, whatever you've got handy is fine, but it should be about this size. We're going to set this down behind your head. We're going to cross your fingers up so that we've got some support. And what we're doing here is trying to offload some of your body weight so that it's on the pillow instead of the roller. And now, instead of alternating like we did before between flexing and extending, we're just going to live in extension on the roller here and try and allow our spine to relax over the roller. And then we're going to introduce a small amount of rotation where we're taking and rotating over so we're on the right side of the rib cage, then back to center, and then over onto the left side of the rib cage. Just a small amount of movement. We want to still keep contact on the roller with our spine. We're not only going onto the rib cage, but we want to try and load to the side of the spine a little bit on both sides. Then we're going to move down a little bit further. Try and feel the ribs fan open in the front as you're doing this. And then again, turn a little bit to the right. Spend some time there, turn back, and then to the left. And we're showing an abbreviated version of this here. Normally when you're doing this, we actually would want to spend maybe a minute or two in this position right here before we even think about turning and dropping to the right and loading the right side. Spend maybe a minute or two there, and then back, and a minute or two to the left. And this is really only a focused treatment for a certain area of the spine that you're having trouble really releasing. So you can work 3 or 4 areas through as you need to with this. And then when you're done, it's going to be a little bit sore when you're getting off the roller, and so you want to move slowly to get the roller back up to a portion of your spine that's not quite as tight as you were just working, and give yourself a minute coming back into a little bit of flexion to allow your spine to relax, and then you'll be finished with that area. Usually when I'm done with this one, I like to do a spine twist right away to loosen up that part of the spine. We've showed this before, but a quick review: lay on your side, top legs bent, and we're just going to rotate the spine, open up, and try and get a good twist through the spine. You can hold that for a minute or two, and then repeat on the other side. All right, good luck and happy rolling.